Now, from 1460 WVOX and WVOX.com, this is United on Health with Maria Gordon Shydlo. This is a show dedicated to your good health. Among the topics Maria will talk about, Medicare and Medicaid benefits, affordable health benefits for small businesses, and other health-related issues. Now, United on Health. Here's Maria Gordon Shydlo.
Good morning. I am Maria Gordon Shydlo, and you're listening to United Healthcare's United on Health on WVOX. Every third Wednesday of the month, we will chat with health industry experts to provide some useful information on such topics as general health and well-being and health insurance. I'm happy to have with me this morning Dr. Patricia Calayag, an obstetrician gynecologist with WESTMED Medical Group and one of the leaders of WESTMED's Dr. Die Challenge, to talk about a New Year's resolutions that many of us make for ourselves this year, and that's losing weight. Thank you for joining me this morning.
You're welcome.
So last month we had a guest from the United Health Foundation to talk about the 2014 America's Health Rankings. And while New York ranked number 9 in obesity, it ranked number 29 in physical activity. And surprisingly, that's only 30 minutes of activity per week. And number 33 in the percentage of the adult population with diabetes. So the last two are pretty alarming, but being number 9 is not so great because the data suggests that a quarter of New York residents are obese. And then, of course, when we take into consideration the number of overweight individuals, I think we can really say that we're in crisis. Does this reflect what we're seeing in Westchester County?
Well, I have to agree with you that there is a bit of an obesity epidemic, if you will. According to the Robert Wood Johnson Foundation County Health Report, Westchester is doing better than the state average at 17% of residents being obese versus 25% in New York, and 20% being inactive versus 24% statewide. But there's certainly room for improvement. Despite being number 9, 17% of our residents equates to 165,000 individuals who are, potentially becoming or have become sick already from consequences of obesity.
So, despite being number 9, why are these numbers so alarming? So you mentioned the fact that it's 165,000 residents just in Westchester County. What are some of the other reasons why we should be alarmed about these numbers? And you mentioned being sicker, getting sicker. So what are some of those? What are some of those illnesses or diseases?
Sure. The health consequences of obesity are pretty far-reaching. They put you at risk for heart disease, type 2 diabetes, stroke, certain cancers, hypertension, liver disease, kidney disease. There's also been associations with Alzheimer's, dementia, respiratory conditions, osteoarthritis, as well as just general poor health.
So you've basically gone from head to toe.
Right.
I mentioned earlier that you're an OB-GYN as well. So in addition to these broader challenges, which again takes you from head to toe, so Alzheimer's, osteoarthritis, heart disease, diabetes, all these diseases, don't women face other issues or other challenges when it comes to being overweight?
Well, they do. I mean, in the sense that, first of all, almost 60%, this is a frightening statistic, 60% of women in the United States are overweight by 2007 estimates from the National Center for Health Statistics. Hopefully we've improved since then. And just over a third of overweight women are actually obese. Those are some scary numbers. In terms of the impact specific to women, fertility, it has an impact on fertility. There's also an impact on pregnancy. If you are going into pregnancy overweight or obese, you certainly have an increased risk for developing preeclampsia, hypertension in pregnancy, diabetes, and you also increase your rate for C-section.
So all of those things. So women out there who are thinking about becoming pregnant should take a look at their weight and try to start managing that, because preeclampsia and some of those other things are pretty significant for not only the mother but the child.
Exactly.
So does this also apply to men? Are there health consequences that are particular to men? I mean, certainly we talked about fertility in women. Does it impact men the same way?
Well, I think it certainly impacts both men and women in terms of heart disease, which is still, women often focus as breast cancer being a scary thing for women, but heart disease is still the number one cause of death. So these are, and the thing about obesity, this is a preventable cause of death. Okay, so, and it is obesity is one of the leading factors in preventable death. And apparently it causes an estimated 200 deaths per year. So, we have, there's something we can do about it.
Well, I think that's what we're going to talk about when we talk about this great program that that you're doing over at WestMed. But with so many adults being overweight, what does this portend for our children? I mean, is there an opportunity? We become so educated about healthy eating and healthy lifestyles, but still so many adults, therefore maybe parents, are overweight. What does that mean for children, particularly in the family environment?
Well, as obesity has increased in prevalence for adults, it has too for children. Childhood obesity has more than doubled in children and quadrupled in adolescents in the past 30 years. Basically, parents need to model healthy behaviors for their children. Studies show that obesity is somewhat contagious, if you will, based on watching how parents eat, exercise, also the foods that are offered within the home, and just the sort of the general approach to a healthy lifestyle you're going to model from your parents.
So this is not a pun, but this is definitely a growing problem. If the rate of childhood obesity has grown so much. But each year, many of us commit to losing weight. So you'd think that by all of us wanting to be leaner and healthier, the number would be improving. And it has improved a little bit across the country, but not certainly to bring us out of, that number for New York, a quarter of the population being obese. So let's talk about why is it so hard to keep New Year's resolutions? And then let's talk about specifically about this one.
Right. Energy intake basically has been climbing since the 1980s, and energy expenditure has been declining.
So what we eat and what we burn.
Right. In the wrong direction.
Right.
We eat, but we don't walk, we don't exercise as much. Our lifestyles have become much more sedentary, in addition to our diets not being as based on, healthy principles. I think that in addition, we've all been there with these New Year's resolutions. The problem is a lot of times you've had that 5 to 10 pound holiday diet weight gain, and you're looking for a quick fix. You want to get off that 5-10 pounds instantly. And it's really been shown that it's, slow and steady wins the race. The quick fixes are often going to have somebody kind of bouncing up and down and not maintaining long-term weight loss. And another issues that people face are what are the diets they go on in terms of not every diet is right for every individual, and it probably does have to be individualized to an extent based on your lifestyle, based on how you're going to be able to maintain some of these healthy eating principles.
So I guess at New Year's, that you might apply that slow and steady kind of wins the race idea to any one of your New Year's resolutions then, whether it be quitting smoking, losing weight, or anything else you hope to achieve. No,
quitting smoking is just do it.
Okay, good.
That's what I would say.
Okay, perfect. So one slow and steady, one just do cold turkey.
Okay.
I'm talking to Dr. Patricia Calayag from WestMed Medical Group, who in addition to being a practicing OB-GYN at WestMed, is also the team leader for the WestMed Doctor Diet Challenge. Why this program? Are your doctors and staff facing the same challenges that other folks do, particularly since they're medical professionals?
Absolutely. I mean, we also, much as you see us running around, our lifestyles outside the office are largely more sedentary than people were previously. We face the same challenges with appetite and all the temptations that we find in our offices and homes to overeat, and finding the time, as our patients do, in terms of working exercise into our lifestyle on a daily basis. So we definitely face the same challenges.
So then tell me a little bit about this program. So your doctors and your staff are facing the same challenges that people outside the medical community are facing. So what are you doing? So how long is the program? What are some of the components? How are you getting doctors to participate? Let me know.
Well, it's called Mission Slim Possible.
Mission Slim Possible. Okay, great.
The doctor's diet. So the idea was we reached out to our physicians and asked them to join this 90-day diet and exercise challenge. We've actually created 3 teams so that we could add a little healthy competition into it. And
that's always good.
Yes, and our diets, we're very relaxed about it because the idea is we just want everybody attempting to eat healthfully and exercising, and to, whether it's through a Metafast diet, through a paleo, through DASH, we're fine. It's just do something and, stick with a program and, introduce a regular exercise program into your life. We are requesting that people, we just started officially the 19th. Some people may have started a little bit earlier, but they will complete a 90-day challenge. And we've requested your weight at the start. We will publish our total team weight, and we will be looking weekly to see how people are doing, and tracking the total team weight loss. The idea here is to show that, we need to practice what we preach. We can talk about it, but we have to show it, and we have to tell it, and we have to act it. So that we so far got 3 teams. The Sliminators from the OBGYN and surgical specialties, and we have about 15 members on ours. The Trimtastics from our medical specialties, and the Meaningful Losers from internal medicine, pediatrics, and urgent care. So as what the program is designed to do is to not only obviously have us diet in a group, and it's been shown that group dieting is somewhat more successful because of the accountability. Mm-hmm. But in addition, we'd like to engage our patients. We'd like them to follow us. We're going to be blogging as we go along. We'd like them to follow and see how we're doing it, where we have our trials and tribulations, our successes and failures, and learn from how we're learning as we go along. So far, we only started yesterday, but we've gotten some good blogs on. People will be sharing their diet. We have 3 coaches for the teens. Julie Dunn from OBGYN. She is specializing in obesity management. The Trimtastics have Dr. Randy Stein, who is an endocrinologist here at WestMed. And the Meaningful Losers from internal medicine, pediatrics, and urgent care have Dr. Nitya Sharma as their coach. So these 3 physicians will also be blogging kind of on tips for weight loss and exercise and general ways of staying healthy and eating healthily.
And then how does somebody, if they want to go see the blog, where is it? Is it on your WestMed Medical Group website?
It's actually, you can get it through there, but it's also at westmeddradiet.blogspot.com.
So I'll have you repeat that at the end so people can take out a pen or pencil.
Sure.
So the goal of the program is to help doctors slim down, adapt a healthier lifestyle.
Well, it's to help doctors, but really the goal of the program is to engage our patients.
Okay.
So the goal of the program is we are going to do it, but our real goal is to have our patients join us.
So does the patients get to root for a particular team? Is that part of this challenge?
Well, they get to do better than that. So once we've proven, we need to prove that we can lose. We need to prove that we can lose some weight,
right,
and that we're a good example to follow.
Right,
so once we've shown that we actually can do this, we will invite our patients to join us and absolutely add their weights to our team totals and their weight loss to our team successes. So we would like them absolutely to follow along and diet with us.
Oh, that's great. So according to studies, losing 5 to 10% of one's body weight may have a significant impact on one's health. So besides decreasing your risk of getting type 2 diabetes, which you talked a little bit about, remind us of some of the other health advantages of losing that 5 to 10%. And I think that was part of some of the early discussion around creating this program.
Yeah, well, just 5 to 10% can lower your blood pressure, as you mentioned, decrease your chances of developing diabetes, decrease your cholesterol levels, lower your risk of cancer, and improve your quality of life.
So what are the key elements of the program, or for us who will not be participating, or I am a WESTMED Medical Group patient, maybe I'll hop on and participate. Where do we get started, or what tips do you have for getting started?
Well, number one, U.S. News and World Report just published on the top 35 diets. So they had an excellent article kind of reviewing options out there. DASH seemed to be the number one, which is not a very complex set of recommendations about basically making healthy food choices. So I think kind of picking a program that you feel you can follow, consider working with a health coach or our nutritionist or one of our specialists in the field of obesity, to guide you along the way. I think those are always a good start. And adding exercise, the recommendations for exercise, as we were speaking about earlier, for moderate activity to at least get 2.5 hours a week. So over 7 days, that's not unreasonable. And if it's going to be vigorous, where you're actually exercising at a level that you can't maintain a conversation, that's even an hour and 15 minutes in a week can make a difference. So that people can fit. You can fit 15 to 20 minutes of some vigorous exercise in your day. At least I'd like to think that.
Well, I think when you put it that way, moderate exercise, 2.5 hours, was that right? And then if you step it up a little bit more, an hour and 15, that certainly cuts.
That's over a week.
And that definitely cuts that time in half. So, and certainly in Westchester County, there's lots of places for people to go, safe places for people to go walking. Certainly we have walking programs at the mall. Gyms are running specials right now. So I guess you're really advocating for people just to find what works for them. And
yeah, I think there's so much on the internet. If you joining a gym is great. For some of us, if you're doing that, that's a great way to maintain that level of activity. But even these, the studies that have been done on the 7-minute exercise program that's available on, everybody can get that app, or 14-minute programs where, you really can raise your heart rate on those, and also, start building muscle mass, which certainly helps with increasing our metabolic rates and making it a little bit easier to lose weight.
And we talked earlier about losing weight and starting off slowly, so slow and steady. So how do you recommend people get started? I certainly think that at the beginning of the year, and I've been known to do this in the past, is, you start the new year, you go on this crazy diet, and you lose the weight, and then 3 months or 2 months, you're back where you started from. So how do we think about healthy living? How do we think about and plan for healthy eating and healthy exercise?
Okay, well, again, everybody wants to jump that 5 pounds in the beginning, but it's been shown that this, setting a goal of slow and steady weight loss at 1 to 2 pounds per week is weight that will usually stay off. You do need to do low-calorie plans. I mean, it's what comes in and what goes out. In terms of it's good to understand your metabolic rate, which you can find out from understanding what your body mass index is, which is based on your height and weight, and you can find that from your doctor, or there are actually many computer programs that you can do online. And when you understand that, if you're trying to lose weight, you do have to have less calories than your basal metabolic rate is burning a day. So if you can understand that and start on a low-calorie eating plan, many of these plans are suggesting you have a minimum of 3 meals a day, and some of them 5 to 6, where you're eating more like every 2 to 3 hours, rather than forgetting to eat breakfast and suddenly having a big lunch, or forgetting to have a snack and eating a late dinner. So I think, even if you can't buy into a commercial plan, there's many plans available that are giving advice on just how to follow healthy eating recommendations throughout the day. In addition, physical activity.
So early in the program, I mentioned the America's Health Rankings. New York ranked number 14 overall, but there's opportunities to improve the health of our state in addition to becoming more physically active. Remember, we were number 29 and losing weight. which can improve our rankings in diabetes and cardiovascular death, which you had mentioned much earlier, actually a few times earlier, are key disease states for people who are obese. But improvements in high school graduation rates, management of infectious diseases like chlamydia and pertussis, or for those who don't know what pertussis is, whooping cough, and a reduction in violent crime can not only continue to improve our rankings, but our health. So for more information on the Health Rankings Report, go to americashealthrankings.org. So I'd like to once again thank Dr. Calayag, from WESTMED Medical Group for joining me this morning on United Healthcare's United on Health. And again, I wish all the doctors at WESTMED the best of health and the best of luck. And we look forward to having you come back again soon. And maybe we could do, so 90 days would bring us till around April. So maybe have you back on the May show for a little bit to talk about the success and also how that success translated to your patients. And then to find out more about United Healthcare, visit www.uhc.com. And, of course, for information about the show or other WVOX shows, call 914-636-0110 or go to WVOX.com. And I'm Maria Gordon Shydlo. Join us each month as we talk to healthcare experts about our health. Until then, be well.
You've been listening to United on Health with Maria Gordon Shydlo. Listen again next month when Maria talks about issues dedicated to your good health on United on Health. Only on 1460 WVOX and WVOX.com.